So thank you. So that means, access for all should not be only seen as the, thick pipe and all that, but mobile is also going to become a, serious access point. But Suku, you have been, covering industry and how this NOFN, National Optic Fiber Network is laying. Is the fiber going to be a, fiber dream or a pipe dream? Is really, because we have, for the last 3 years, we have been only extending the dates of getting this NOFN everywhere to all the village heads and all that. Any idea, is it possible, not possible? Because telcos are not participating in this movement at all.
See, I think this is one of those things which will happen at some point in time. Right. No, the thing is, if it doesn't happen in the next 5 years, it will probably not be required, right? Because broadband wireless will happen. There will be other technologies that happen. Sure, at the very back end, you will need fat pipes still, but you will not really need it the way it's been visualized if it doesn't happen in the next 5 years. I think it could happen in the next 5 years, right? But you'll have to understand that everything needs a certain timing, right? What the government is trying to do right now with this whole Digital India thing, and another reason why some of the companies we've covered in Manthan are now more relevant than they are before, is because of 2 or 3 things. The first one is you now have a certain basic number of mobile connections. You now have a certain basic number of mobile internet connections. You have the ability to address your government services at an individual level, because this addressability is made possible through the unique ID, which wasn't there till a few years back. Right? If you want to deliver specific government services to one individual, it's something that's possible, right? I know various people see it as various things, right? There are some people who come to me and speak of it as a card, but I just look at this ID, and to me, it's just a number around which you can build any app, right? And which addresses services at one particular individual or a group of individuals. And at some point in time, I guess mobile internet, mobile broadband internet will take off. I don't know whether it's going to be the private sector which is going to be the driving force there, or whether it's going to be the state which is going to be a driving force there. But we are headed in that direction. I don't think there are too many other countries in the world where the kind of applications that are available on feature phones in India are available, right? So we are progressing on the right path. So to me, it's the most important thing about India is you have to be patient, right? For anyone, if you're a company, if you're an individual. On the way here, I was held up in 4 or 5 places, highly unnecessary traffic jams. But you have to be patient. You can't lose your cool. So my long answer to your question is, it will happen. Just be patient about it.
Thanks, Suku. We waited 60 years. We can wait another 5 years. Yeah. So this is interesting. You know what? Despite of everything, or in spite of everything, things will happen. It doesn't matter whether government is going to do it or private sector. Because of technological innovations and the huge demand, it is going to happen in one way or the other. And that brings to me European Union, all the way from Europe to India, doing overarching background of RTI. That's what I remember, that in the big project that you people are doing, is that how this right to information can be seen as that right to entitlements, or reaching the entitlements and making all this information go to the people. But you're doing only about 20 states, 50, 60 districts. What do you see as huge hurdle? Because you work directly with the not-for-profit, I have seen that you haven't gone to the, government to work with them. You have gone directly to the civil society to work to make it happen. Do you see some trend there? What do you see? I mean, in the light of Digital India, in the light of this access is not really available everywhere, but entitlement is something that is required at the bottom of the pyramid, now and then every time. That's their life.
Okay. I don't know if I'll answer your question exactly, but because you talk about the RTI, My understanding here is that often civil society has understood the RTI as a tool to kind of really trouble the government. That's a good tool to do that, but the initial intention of the RTI, as I understand, is not that. The initial intention of the RTI is to encourage and push the government itself to provide information. You know, the famous suo motu, or public disclosure, proactive disclosure of information. So when we have engaged with organizations like DF and others, we've told them, listen, we think a RTI is Right to Information Act is very important, but we wouldn't like you to use it as your first line of intervention if it is to complain about anything. We would like you to work in collaboration with line ministries, with local governments, in districts, in blocks, in villages, and to try to work with existing line ministries, governments, to try to help them make information accessible. So that's one thing, because it's also about a culture of a number of civil society organizations who. And why I'm saying that, because we had a discussion before we started with a colleague here, and she was telling me that we are working on the internet rights. So I said to her, do you also talk about internet obligations? I mean, obligations. You talk about rights of people, but to those you say they have rights, you also to them they have obligations, because otherwise it's too easy and it's not very conducive. Because otherwise it's like, okay, there are entitlements, we are entitled to get these rights, so the government has to give us these rights, okay, but hang on, we have to be realistic, there are limited resources also, and it's not just about rights, it is about rights, it's also about obligations. So, back to your issue of trends, I hope that we are encouraging a more responsible behavior of some civil society organizations. I'm not saying that they're all not responsible, and sometimes you need some non-responsible or very impatient ones, you do need that, but you do need responsible organizations who engage constructively with government and the private sector, actually, whoever can reach at scales. So maybe later on I come back to your question, but I wanted to make that point because I think also to see trends, to see trends that matter, I think it's when different actors work together. So I think if the media, the government, the private sector, civil society work in a similar direction, we will all be doing different jobs, but if we work in a similar direction, then there's many, many more chances that things will happen and that we will see trends.
Wonderful. So I think we have lots of NGOs here. We have a lot of responsibility if we have not had that in earlier. That brings me to Dave. Dave, you are going to create a platform to really, have the validated NGOs online for the first time in the history. That there will be a domain which will only have those which is validated. That means every NGO who cannot validate themselves and cannot be validated won't have a domain called .ngo. How do you see this? I mean, is it going to be a challenge, or it's going to be a huge opportunity? Because everybody, puts a finger on NGOs that you guys are, not really reliable. We don't know. There are lots of questions, and so on and so forth. So, can you put some quick perspective onto that one?
Yes, Summer, I can. So, it is a challenge, and there are many challenges in delivering what we believe will be a huge opportunity, but we also believe it's something that has to be done. The entitlement of access is not just the entitlement of consumption of data and content, but it's also the entitlement to create content, to create an entity or an identity online. At Public Interest Registry, we've been doing that for over 10 years with the .org domains. If I could ask the audience here, if you could raise your hand, if you have an online presence, do you have a social media account, a website, Twitter account, Facebook? Okay, keep your hands up if you have a website. If you have a website, a platform where you can put your message. Okay, and keep your hands up if that website is on a .org.
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 So we have a right mix.
Yeah, it's a good little mix. So Public Interest Registry about 3 years ago came out to India, to other parts of the world, and asked, how can we help give you a voice and a presence online? How can we help to carry your message to the corners of the globe? And over the last 3 years, we've heard from the NGO community there's definitely a need for validated online community where NGOs can connect with one another, where they have a platform to carry their message across the globe, and quite honestly, an ability to raise money. And that's why we put together our plans around .ngo. .ngo will be a validated online community for NGOs to be able to communicate with one another, tell their message around the world and raise money.
Yeah, please.
So as Osama mentioned, we're looking at launching .ngo at the beginning of next year. We believe this will be a great opportunity for the NGO community globally to be able to put their message out there, to be able to do it in a validated space, to be able to find like-minded NGOs to communicate, to share ideas, to share trials and tribulations, and to improve in their mission accomplishment. And also to be able to connect to donors wherever they may reside, whether it's in Northern America, Europe, Australia, Asia. The ability to be able to do a validated space online that is recognised globally will lend credibility to those NGOs. It will also help donors make decisions. There are donors globally that really do want to contribute and help, and we're going to give them a platform to be able to do that.
So what is interesting is that, like Aruna said in the beginning, that we need to all work together. That's a very important thing. Laurent also said that we have to be responsible to take initiative to work together towards a goal. Dr. Rajan Kumar also said that it cannot just happen from one corner. So this is very interesting that if you have a bunch of hundreds and thousands of NGOs who are validated, who are all trying to do good, and can all work together, because there is always a question that who is right, who is wrong, and all that. And then all this digital level can all come together and do the single goal of making digital go towards the end. So I'll now come to Soumitro. We need to discuss about our health. If we are all not connected, the primary health centers are not functional, and health workers do not go there, the doctors do not go there. What really you think, how digital can help it, and how do you wish that your wish can make that happen?
Good question. First of all, thank you very much for this opportunity to be here. And I would like to thank all the awardees and also the participants who have gone through the various rounds of, the award. And so, thank you very much. And it's because of you guys that we are here. Otherwise, we won't be able to sort of come and speak on these kind of difficult issues. Coming to the healthcare, we are in the healthcare, and so I would like to sort of focus on the healthcare part. Primary healthcare, as we know, has been a neglected area. And because of the neglect in primary healthcare, there are various verticals which have been tried over the past many years, like HIV or TB or family planning or maternal health. They have improved, but they have not been able to achieve the desired results. And that's because the basic system through which all these specialized diseases can be addressed have not been working or functioning efficiently. The challenges are many. I mean, going by the WHO estimates, we need about 85,000 doctors in this country to cater to about 850 million, the base of the pyramid population. We have 25,000. It's a huge gap of 60,000. You spend another 60 years, you will not be able to meet this gap. So we need an immediate solution. We need an intermediate strategy to encounter this kind of challenges. There have been a lack of willingness in terms of paraskilling, task shifting, because not necessarily primary healthcare worldwide has been provided by the qualified MBBS doctors. Yet, our policies, our regulations do not permit us to use semi-qualified Ayush doctors, and ultimately when you go to the PHCs, who do you see? It's the nurse who takes care of you. 80% of the work is actually done by the senior nurses. The doctor comes when there is something which is very serious. Now, so these are the issues that actually make the life a little more difficult. Then you have things like, there are lots of these new innovations coming, the low-cost devices. If you look at the diagnostics, people have to travel 50 kilometers, 20 kilometers, 100 kilometers to go for a test. The travel itself would cost about $500. And that is almost a week's income for a rural family. If you look at the medicines, the recent study I was going through, on an average in Bihar, UP kind of states, the EAG states, about 1/3, it's only 1/3 of the CHCs, which is the community health centers, actually have the EML, the essential medical medicines available. Imagine, 2/3 of them do not have that. So what are we talking about? Even if I come to the center, even if the doctor is there, the medicine is not there. So my problem will not be taken care of. Now, these are not the simple problems. Again, the poor infrastructure definitely creates a problem, but there are other logistical issues that need to be addressed also. There are bigger issues, health-seeking behavior. If I learn something and then I have to go and change my behavior, it's a huge process. It's a huge problem because I have to go and queue up in the PHC. I have to spend so many hours. I will lose my wages. I will lose my income. So should I do it or should I not do it? Let me fall sick. Let me about to die that time. Let me go. Well, that's better solution. These are very practical issues, and this is where starts the challenges. How do we address? Now, the digital and IT have come in a big way, being an enabler to many of these problems. The telemedicine have been tried in this country for many years, starting from ISRO, who empowered about 5,000 centers in Rajasthan, and it was one of the best systems which were put in. It was working. There's a lot of investment, but two things were missing. Not many patients were coming, and number two was that there were not many doctors sitting on the other side to provide the telemedicine or the teleconsultation. The IT department did a fantastic job. ISRO did a fantastic job. But the two things, mobilization of the patients and the provider to take care of that, was not handled. So now if you go back to Rajasthan or even UP, you talk about telemedicine, you will only hear negative words. You'll say, don't talk about telemedicine, that doesn't work. But look at the private sector options. There is World Health Partners in Bihar. It's almost 1 million teleconsultations which have been done in the last 5 years. It's working very well. The remotest part of Bihar has been connected through the Sky chain, and it's working. So it works. You have to make it work, and that's really the more good experience we create with this digital and the IT. I think that works. One other point I would like to mention is this: the monitoring in a country like us is very critical. Ashas, they are very good. They have to do a lot of stuff. But what happens is these ASHA workers or the ANMs, they need supervision, they need guidance on a regular basis. In a large, vast country like us, it becomes very costly to design any kind of manual monitoring and supervision system. And this is where, again, the mHealth and the digitization really helps because they get real-time sort of inputs. Finally, Madam, I can't agree more with you that, integration. I've seen Ashas now walking with 6 cell phones, with 6 different apps, and then 2 tablets also. No, that's not the way. I mean, she is supposed to do her work. So it has to be integrated. It has to go through one particular ways of, providing those solutions. And that is what is very critical. Everybody is coming with one solution and is dumping on the Ashas and the ANMs and the health system. That's not going to solve the problem. We have to come together on one platform and address this. Thank you.
Thanks, Sumit.